Hello, Mr. Hernandez. My name is Andres Baeza, and today I'm going to be doing a head to toe assessment on you. Do you have any questions
No.
before we start?
Not right
Okay, so we're going to stop on, we're going to go from the top to the bottom. So first, I'm going to be inspecting your your whole head, your face, and all that. We already took your vitals; they were within normal limits. We took your weight, your height, everything was good, and you went to the bathroom before we started this, so we're ready to start. Okay, so first I'm gonna inspect your ears to see if they're aligned, symmetrical. Your eyes. Do you mind taking off your glasses for me, please? Very good. Are you having any pain at all?
now.
Your scalp. No dryness. Very good. Can you open your mouth really fast? Okay. Any pain there? Any sores?
No.
Okay. Can you clench your teeth for me? Okay. Can you puff up your cheeks? Can you raise your eyebrows? Can you smile? Can you stick out your tongue and move it side to side? I'm gonna just have you say ah, and I'm gonna test your gag reflex really fast.
Ah.
Very good. So, no questions? Okay, so I palpated your hair, your scalp. It looks healthy. There's no nodules, no lesions. Your tongue looks good. Those were part of your cranial nerves. Um, Let me see your mandible. Very good. Any pain
Mm-mm.
at all?
No.
Okay. Okay, now we're gonna do. I'm gonna lightly touch you, and you're gonna tell me if you feel. So this is pretty much just testing for a light sensation. So you tell me. Can you close your eyes, please? And you tell me if you feel it, where you feel it.
My forehead.
Okay.
Cheek. Chin.
Very good. Now we're gonna move down to your eyes. Do you mind taking off your glasses again? Right now I'm just inspecting them to see if there's any redness, any discharge. I don't see anything, any abnormal movements at all. Do you have any pain with your eyes?
Mm-mm.
Trouble seeing?
No.
Okay. Let me see your conjunctiva. Nice and pink. No discharge. Okay, I'm gonna ask you to cover one eye for me, please. Yeah, that one's good. Okay, so now I'm gonna do the near vision test. So I'm just gonna hold this right here, and I'm just gonna hold my hands, and you're gonna tell me how many fingers you see.
Two.
Very good. Can you do the other eye now?
One.
Very good. Let's look straight at me, and just look at me straight, and you tell me how many fingers I'm holding.
One.
Very good.
Two. One. Two.
Okay. Now follow my finger with just your eyes, not using your head. Very good. No abnormal eye movements were observed. Your visual fields were normal. Um, Now let me see. Let me continue with your eyes. Let me check your pupils really fast. Just look straight ahead. Very good. Good pupil reaction, accommodation. Now let's move on to your ears. Let me inspect them really fast. Any pain when I touch them?
No.
Very good. Let me look inside. Can you look that way really fast? Very good. Now the other way. Thank you. Tympanic membrane looks normal, fairly gray. Any trouble hearing at all?
Mm-mm.
Okay, I'm gonna ask you to cover your right ear for me, please. And I'm gonna whisper a couple words, and you're gonna tell me what I'm saying.
One. Red.
Okay, very good. Now can we do the other ear?
Blue. 5.
Okay, very good. So that was the whisper test. Your auricle looks normal, no tenderness, no pain. Very good. Now we're gonna move on to with using a tuning fork. We're gonna do the Weber's and the Renee's test. Okay, so first I'm gonna put it on each ear, and you're gonna tell me when you stop hearing the noise. Okay.
Okay.
First I'm gonna put it on your bone, which is the bone conduction, and then air conduction. Okay.
Okay. Stop. Stop.
Very good. Now let's do the other ear.
Stopped. Stop.
Okay, now we're gonna do the Weber test. I'm just gonna put it on top of your head, and you're gonna tell me if you can hear it on both sides equally.
Yes.
Yeah?
Mm-hmm.
Very good. Now we're gonna move down to your nose. It looks aligned. Any pain on your nose? Any unusual discharge at all?
Mm-mm.
Okay, very good. I'm gonna touch your nose, your septum. It looks aligned, symmetrical. I'm gonna ask you to cover one nostril and breathe in to see if you're able to. Any trouble?
Mm-mm.
Now can you do the other one, please? Very good. Patency on both nostrils. Let me look inside your nose really fast. Can you look up for me? Very good. Very good. No swelling. Turbinates look good. No redness. Mouth. Any pain on your lip area, mouth area? Can you open your mouth really fast? Okay, very good. Say ah. No redness. The dentition looks good. Tonsils are there. Very good. Any questions so far?
No.
Lips look good, nice and moist. The gums, the palate, oropharynx, all that looks good. The pharynx. Let me see. Gag reflex was present. Now we're gonna move down to your neck. For your neck, I'm gonna check your thyroid, your lymph nodes, and all that. We'll start with your thyroid. Can you look down for me a little bit? Can you swallow for me? Very good. Nice, normal. No, it's not too big. No jugular vein distension. I'm gonna ask you to shrug your shoulders. Very good. This is also part of the cranial nerves. Let me see. Can you move your head side to side? Up and down? Can you make a circle? Good range of motion. I'm gonna now with resistance. Can you go to your left? Very good. Now to your right. Very good. Let me check your. Tell me if you feel any tenderness. I'm checking for your sinuses.
No.
Any pain?
No.
Lymph nodes.
Mm-mm.
Very good. Supraclavicular lymph nodes. I don't feel anything. That's good. Occipital, all those. Submandibular and posterior clavicular. Let me auscultate your carotid and your thyroid to see if I listen to any bruit or anything like that. Your thyroid. Everything sounds normal. Let me see your hands. Any pain at all? No dryness? Your arms? Everything looks normal. Shoulders, you were able to shrug. Skin, everything looks good. Now that we're here, let me check your pulses. We'll do your radial. Your brachial. They feel normal, they're not bounding. Okay. Very good. Now we're gonna move down to your lungs and your thorax and all that. I don't see anything here. Very good. No accessory muscles being used. Are you having any troubles breathing at all? Okay. We'll do the tactile primitives. So what I'm just gonna put my hands over here and I'm gonna have you repeat the word 99.
99.
Again?
99. 99. 99.
Very good. Now, very good. The primitives was good, palpable. Now I'm gonna percuss on the back of your chest. Okay, I'm gonna check your kidneys. You let me know if you feel any pain.
No.
No pain?
No.
Very good. Any questions so far?
No.
Now I'm gonna measure what is known as the diaphragmatic excursion. I'm gonna have you take a deep breath and then you're gonna hold it. And then again, when I tell you, you're gonna take a deep breath and you're gonna let it go. Okay, so take a deep breath and hold it. Okay, breathe out. Take a deep breath. And let it out. Very good. Diaphragmatic, that was normal. Now we're gonna do move on to the auscultation of the lungs. We'll start from the anterior, we'll do the posterior. So just take a deep breath. Take a deep breath. Very good. Deep breath and let it out. Deep breath and let it out. Very good. Lungs sound clear bilaterally. No wheezing, no adventitious sounds. Everything sounds normal. Your skin on your chest is asymmetric. Respiration, effort, normal. No pulsations, no heaving. Very good. Chest wall. I'm going to palpate the chest wall. Ribs. Very good. No knots. Okay. Now let's go on to your heart. I'm going to remove this really fast. So we're going to auscultate your aortic area, your pulmonic, Erb's point, tricuspid, and mitral. Very good. Rate and rhythm regular. I'm gonna have you lean back, and I'm just gonna do your abdomen really fast. I'm gonna auscultate it, assess it, and percuss it really fast. So first I'm gonna inspect it. It looks very good. Any pain, any tenderness? Let me go ahead and auscultate it. Very good. Bowel sounds on all four quadrants are normal active. I'm gonna do light palpation. Any pain?
No.
I'm gonna go a little bit deeper. Very good. Then percuss here. Very good. No tenderness? Okay, you can sit up for me. Now we're gonna move down to your feet and legs. Let me see. Very good. Skin looks good. No dryness. No swelling. Any pain when I touch it? Hair distribution. Very good. Temperature feels warm and moist. No edema. Let's do the pulses. Do you mind taking off your shoes for me really fast? Just one. I'm gonna feel the pulse over here. Very good. That's the dorsal pedis. Now we're gonna do the posterior tibial. Okay. Now the popliteal. Very good. You can bring it down. Next is the cranial nerves. Cranial nerves we pretty much did already. I'm just gonna have you do the ones remaining. I'm gonna have you smell this, and you tell me what it smells like.
Okay.
Very good. That's cranial nerve number 2. I did cranial nerve number 2, which were the eyes. 3, 4, and 6 were the oculomotor. Trigeminal, we did. You felt the light touch. The tongue, the hypoglossal. You shrug your shoulders. So we're done with those. Sensation, I'm gonna have you close your eyes and let me see, and just you tell me if it's sharp or dull.
Sharp. Dull.
Very good. Any questions so far? We're almost done. Let me see. I'm gonna have you stand up for me really fast. We're just gonna check your musculoskeletal, your cervical spine. Just look straight. Any pain? It looks straight. Your cervical spine. Can you touch your toes? Very good. Can you try to lean back a little bit? Any pain?
No.
Lumbar spine, everything looks normal. Can you have a seat again? Now I'm just gonna do your tendon reflexes. Very good. This one. Any questions? Let me see. I think that does it. I checked your all your reflexes, your brachial, your knee, your Achilles. Um, any, so I think that does it. Thank you so much, Mr. Hernandez.
Thank you.